Heart disease is India's biggest killer. Every year, it claims more lives than any other condition. Millions live with undiagnosed heart or lung problems, never knowing until it's too late. On the front lines of healthcare, the stethoscope remains a fundamental and indispensable diagnostic tool for doctors and nurses despite advances in medical technology. A device that hasn't fundamentally changed since the 1800s. It listens and helps diagnose various medical conditions by giving detailed sounds and audio clues. In rural India, where specialists are scarce and primary health centers are overcrowded, the gap in medical resources costs lives. Subtle murmurs go unheard, early warnings are missed, and preventable deaths keep mounting. For Dr. Satish Somaya Jeevanavar, this was unacceptable. As a physician and entrepreneur, he asked a simple question: what if the stethoscope could do more?
One of the important and the most critical challenges in healthcare is, even today in 2025, 50% of the world's population does not access primary healthcare facilities. And the biggest disease burden is non-communicable disorders. Within that, majority of the NCDs are due to cardiac and respiratory disease conditions. So traditionally, if you see how healthcare has been practiced, usually the first point of contact for a patient is a primary healthcare clinic where you used to have a general physician or a family doctor. But one of the problems with this structure, if you look at the diagnostics, like let us say chest X-ray or echocardiograph for valvular heart disorders, these are usually not found in the primary healthcare facilities. That's how we thought if we can solve the access issues by bringing in solutions like AI Steth, which help in early screening and detection of cardiorespiratory diseases, it would solve one of the major challenges in early screening and detection.
That question led to AI Steth, an AI-powered digital stethoscope born in India, designed for the world. At first glance, it looks like any other, but inside it's a different story. In analog mode, it works like a classic stethoscope. In digital mode, it records sounds, converts them into waveforms and spectrograms, and runs AI models trained to spot abnormalities. It can store and share results instantly, turning a local checkup into a networked diagnosis. This is what the team calls seeing the sound, a way to make auscultation measurable, evidence-based, and shareable.
How the product works is it captures 30 seconds of heart sound, transmits via Bluetooth to a smartphone, and in less than 2 minutes it creates a visualization which actually mark where is S1, S2. In fact, a doctor might actually mishearing certain nuances of the heart sounds. There is a phonocardiogram printout which gets generated at the end of the auscultation, and that actually helps the physician and other healthcare professionals to not miss any nuances of the critical heart sounds.
Already, AI Steth has screened more than 25,000 people for valvular heart disorders in Bengaluru alone. Each screening is a chance to catch the disease early and suggest treatment that can save lives. In rural clinics, nurses and health workers are using it to build trust and confidence. Patients don't just hear a doctor's opinion, they see their heartbeat on a screen. They carry away more than advice, they carry proof.
Traditionally, if you look at healthcare, ECG, chest X-ray, most of the investigations come with a report. But stethoscope, which is so fundamental part of the clinical examination, was subjective all these years because the doctor's diagnosis was just based on the acoustic input. So even if you meet 3 different cardiologists and they are seeing the same patient, all 3 might have a different opinion. So that is how we converted the acoustic waves into visual signature pattern, which gets generated in the form of a phonocardiogram. So what you might miss hearing, you can see that. So we combined acoustics with the visual report.
We have 4 different locations on in terms of heart sound. So all 4 different heart sounds, 4 different locations have been captured. A minimum of 30 seconds of recording is required. So the Bluetooth transmits the heart sound to the smartphone, and in less than 2 minutes, the heart sound actually sends it to the cloud, and you get a visual pattern which is called the phonocardiogram printout. And then it also identifies whether the heart sound heard is normal or if there is any presence of murmur. So in case if there is a presence of murmur, the frontline worker or the actual user refer the patient to a nearby tertiary care hospital. So earlier, like, we need a cardiologist who is capable of identifying this different heart sound. But now with this easy to use app, even a frontline worker can actually identify if there is any abnormal present in the heart sound, and they can actually do the referral.
The device has the potential to change how frontline healthcare is delivered. Imagine every ASHA worker, every nurse, every small clinic equipped with a stethoscope that transforms listening into measurable data, making diagnosis evidence-based and results instantly shareable.
So when we started at an idea stage, almost 99% feedback was, why do you even need to reinvent the stethoscope? It has been there for so many centuries. So nobody believed in our concept. Probably many people did not even understand the concept of AIML, what we are trying to build. Doctors resist change because they are used to a certain way. So and not just the doctor. In healthcare, there are 5 stakeholders like patient, physician, provider, payer, and then the pharma or the other partners. So behavior change with any of these stakeholders is a big challenge.
Of course, challenges remain: training users, ensuring connectivity, building trust among doctors, and keeping costs affordable. But the mission is clear: to democratize diagnostics, to make advanced tools available at every primary health center, every village, every doorstep.
I think more than the doctors, the allied healthcare workers found it to be like an aspirational device, and they felt that, okay, we are also contributing to screening and early detection, because these AI Steth, the early deployments were part of NCD screening program, some of the government initiatives in the primary healthcare clinics with the government of Maharashtra, some districts in Karnataka, and now in Uttar Pradesh. So we have seen that the ASHA workers or the allied healthcare workers play a critical role in the last mile connectivity. Now, when they looked at technology can bring in such a change and revolution, this is basically like, try to imagine what used to be the expertise of a cardiologist or an MBBS doctor. Now, with the help of AI Steth, they are able to also identify some of these abnormalities and then refer the patients to a cardiologist.
It's an ambitious vision, but if achieved, it could reshape India's public health landscape and set an example for other countries facing the same crisis. 2 centuries ago, the stethoscope transformed medicine by giving doctors the power to listen. Today, AI Steth is transforming it again by giving them the power to see, to turn sound into sight.
Our goal is actually to reduce premature death due to non-communicable disease by 30% in 2030. That is our goal. And if you see our company tagline, it is screen, detect, and predict. So we have already launched the product for screening and detection, early detection. So our vision would be actually to work on the prediction.
This is what impact looks like. Technology that doesn't just innovate, it includes not just invention, but prevention. A lifeline that, when given to every health worker, becomes the first step to hearing and seeing the initial report on cardiovascular and respiratory health. Every 8 minutes, a woman in India loses her life to cervical cancer, a disease that is almost entirely preventable. The tragedy isn't that we lack the science. The tragedy is that we lack access. Unlike many other cancers, cervical cancer can be caught at the very first sign of trouble, long before it turns life-threatening. Early detection means a simple outpatient procedure, not years of painful treatment. And yet, only a tiny fraction of Indian women ever go for screening. Why? Because the current system demands they travel to a clinic, undergo an invasive pelvic exam, and answer questions that are often judgmental and uncomfortable. For millions of women, that barrier is simply too high. This is where social entrepreneurs step in, to bridge the gap between what science makes possible and what society makes accessible.
Unfortunately, in India, the scenario is not very pleasant. More than 80,000 ladies lose their life annually due to cervical cancer. Now, one thing that we notice is that preventive screening in India is absolutely dismal as far as cervical cancer is concerned. The WHO has actually targeted 70%, whereas in India, the ratio is actually less than 1% as of now. Women are not very happy to undergo the process of pelvic examination to collect the samples by themselves. Women have to actually wait for a lot of time outside screening vans to collect their samples, to basically stand in that queue and again go back to a pelvic examination chair, which is again not pleasant. So these are the things that's really broken in the system, and these are the specific problems that we as a startup Pragmatech are concentrating upon to encourage more women to actually take up cervical cancer screening.
For Anirban and Shayantini, the mission was deeply personal.
We lost one of our housemates to cervical cancer. When she was with us, she used to just complain of simple problems like fatigue, back pain, cramps in the leg, or maybe weight loss. But nobody ever thought that those things could actually culminate into her losing her life to cervical cancer. Everyone used to pitch in by giving multivitamin tablets or something like that to ensure that she is properly taking her food, her nutrition is proper, but the problem was much deeper. That's how silent cervical cancer is. HPV, human papilloma virus, which causes cervical cancer, resides in the body silently for several years before it actually catches up with time to give out symptoms and finally manifesting into cancer. So it is our responsibility that we catch that infection early or in time. So this is where the entire fight against cervical cancer started, and started in a very personal manner.
Anirban left his job at Roche Diagnostics. Together with their co-founders, they spent the next 4.5 years building, cross-examining and licensing a device that could change everything. The result? CerviCheck, India's first clinically validated at-home self-sampling kit for cervical cancer. A simple, discreet device that lets women collect their own samples in privacy with dignity and with accuracy equal to tests conducted at clinics.
आज के ज़माने में हम काफ़ी आगे बढ़ गए हैं, काफ़ी नई टेक्नोलॉजी आ गई है और उसी तरह से ये ह्यूमन पैपिलोमा वायरस इन्फेक्शन है उसे काफ़ी अर्ली स्टेज में आइडेंटिफाई करने के लिए हमारे पास काफ़ी एडवांस टेस्ट है जिसे हम HPV DNA टेस्टिंग कहते हैं। ये बहुत ही एक सिंपल सा टेस्ट होता है जिसमें फीमेल डॉक्टर द्वारा या फीमेल नर्सिंग स्टाफ द्वारा गर्भाशय के मुख से एक सैंपल लिया जाता है जिसे सर्वाइकल स्मीयर बोलते हैं और ये सैंपल बाद में लेबोरेटरी में टेस्ट करते हैं और इसमें हमें पता चलता है कि HPV का इन्फेक्शन है या नहीं है। अभी ये टेस्ट हमेशा एक फ़ीमेल डॉक्टर द्वारा लिया जाता है जिसकी वजह से कई बार लोगों में संकोच होता है और थोड़ा सा जो संकोच के कारण वो लोग खुल के सामने नहीं आते और स्क्रीनिंग नहीं करवाते। तो इसका एक ऑल्टरनेटिव अभी हमारे पास है जिसे हम सेल्फ सैम्पलिंग टेस्ट कहते हैं। कई कंपनियां ये टेस्ट करती है। भारत की भी एक कंपनी है जिसे सर्वीचेक कहते हैं। सर्वीचेक द्वारा ये सेल्फ सैम्पलिंग टूल एक बहुत ही आसान तरीके से बनाया गया है जो हमारे यहाँ की ग्रामीण फीमेल, रूरल एरिया और ट्राइबल एरिया की फीमेल बहुत इजीली यूज़ कर सकती है।
But invention is only half the story. Impact comes when it reaches those who need it the most. In partnership with NGOs and CSR programs, Survey Check has already reached thousands of women from Chennai's urban poor to remote villages in Uttar Pradesh and Gujarat.
In Indian settings, there are many kind of stigma कि हमें नहीं हो सकता है, अगर हमें कैंसर है तो इसकी कोई ट्रीटमेंट ही पॉसिबल नहीं है, हम कैसे करेंगे, बहुत खर्चा होगा, एंड मैनी काइंड ऑफ स्टिग्मा आर देयर कि वो आउटलाई हो जाएंगे सोसाइटी से, सोसाइटी उनको कुछ अलग नज़र से देखेगी, लाइक पिटी ऑन देम. So it is mixed kind of reactions in that also. In Indian setting, it is really difficult to make a time proper time zone for a women to get screened. हम स्क्रीनिंग करने जाते हैं, बहुत सारे विमेंस ऐसे आती है, जल्दी जल्दी ख़त्म करो, हमारे पास टाइम नहीं है, घर पे बच्चे हैं, हस्बैंड है, हमें खाना पकाना है. तो वी स्टार्ट अ कॉन्वर्जेशन विथ अ नॉर्मल इंफॉर्मेशन अबाउट कैंसर, सर्वाइकल कैंसर, व्हाट आर द कॉजेज़, और ये ट्रीटेबल है. फर्स्ट वी हैव टू गिव देम होप कि ये पॉसिबल है. देन सेकंड, देर आर मैनी लाइक स्कीम्स अवेलेबल, उनकी वजह से उनको कोई बहुत सारा आउट ऑफ पॉकेट एक्सपेंडिचर नहीं होता. मैनी थिंग्स आर देयर. सो इफ दे गेट द करेक्ट इंफॉर्मेशन एंड गाइडेंस, इट इज़ पॉसिबल टू कन्विंस देम एंड गेट देम स्क्रीन्ड एंड डायग्नोस्ड ऑल्सो.
इसमें ज़्यादा कंफर्टेबल लगा, क्योंकि अब घर पे भी हम कर सकते हैं, अपने आप से कर सकते हैं, कभी भी चाहे कर सकते हैं. वो तो डॉक्टर के पास नहीं तो हमको जाके करवाना पड़ता है, और डॉक्टर के पास थोड़ा अनकम्फर्टेबल लगते हैं. जितना यहाँ पर हमने आज किया है तो बिल्कुल कंफर्टेबल, इजी वे, बिना पेन हम कर सकते हैं. तो मैं उसको ज़्यादा लाइक करती हूँ. एडवाइस भी काफ़ी लोगों को मैं करूँगी कि नहीं, ये करना बहुत आसान है और बहुत इजी वे.
Women who might otherwise have been tested now have a chance to take their health into their own hands. Today the kit is available D2C at 1700 rupees with testing included. For large-scale public health programs, the device alone could soon cost as little as rupees 100, cheaper than the cost of a bus ride to a camp.
We can achieve a situation where we are among those countries which have fewer cervical cancer rates in India. Along with the self-sampling, at-home self-sampling kit SurveyCheck, we are also working on a screening kit that is largely targeted towards public health that can detect precancerous lesions. At-home self-sampling kit SurveyCheck, along with the point-of-care diagnostic test, we will be able to reduce cervical cancer incidences in India and take India among those countries which have fewer cervical cancer cases.
Imagine the possibilities if every ASHA worker could carry this in her bag and every woman could use it at home just as easily as taking a pregnancy test.
We are getting in touch with the ASHA workers, with the health workers who are locally available in the villages, and the government programs, who are already in touch with the village women and whom the village women trust, which is easier for us to get in touch with the women and encourage them to take up screening by themselves and use the self-sampling kits and take up screening by themselves.
From winning global innovation challenges to clinching investment on Shark Tank India, Pragma Tech's journey shows what happens when science meets social mission. But their first achievement isn't the awards, it's the lives they have already saved and the countless more they will. Cervical cancer does not need to be India's silent killer. With innovation, access and awareness, it can be eliminated in our lifetime. The solution is already here. What we need now is the will to scale it and make it visible so that women both in cities and rural Indias can have access to this life-saving tool. This is what impact looks like. Not just invention, but inclusion. Not just a product, but a promise that health, dignity, and life itself are not privileges, but rights.
From payments to savings to investments, almost everything we do with money is now digital. But as our world gets more connected, fraudsters are getting smarter too, using new tricks every day to steal people's hard-earned money. From fake links and phishing calls to digital payment scams, financial fraud is rising at an alarming pace across India. That's why platforms such as IDFC First Academy are essential. They make it easy to understand how to spot and prevent financial fraud, as well as develop know-how about other financial topics. At its core, fraud is when someone tricks you into giving away money or personal information. And in today's digital world, knowing how fraud works is as essential as knowing how to save or invest. The common types: phishing emails, card skimming, digital arrest scams, fake links. Different names, same goal: to cheat you. The red flags are usually clear: unusual links, unbelievable offers, or urgent requests for payment, like how they pretend to be your relatives caught up in an emergency and ask for help. Always remember, if something feels off, it probably is. The smartest way to fight fraud: awareness. The best defense is awareness. Stay alert, stay informed, and safeguard your hard-earned money. You'll avoid most traps. That's where IDFC First Academy can help with simple interactive courses on frauds that explain the tricks and show you how to keep your money safe. So join IDFC First Academy and start your journey of financial literacy now.